But for people diagnosed with cancer that are of childbearing potential, we have to consider how this testing could impact them. So we never know what someone has been through, and it's important to lead with empathy while providing education of the importance of this testing. So someone may find now that finding that pregnancy testing is a dreaded experience instead of what they thought would be a joyous one. They may now have those feelings of anxiety, fear, uncertainty, confusion.
You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Jaime Weimer, Manager of Oncology Nursing Practice at ONS. And today we're talking with Marissa Fors, Director of Specialized Programs at CancerCare, based in New York, about psychosocial considerations for pregnancy testing in cancer care. As a reminder, you can earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Welcome, Marissa. Thanks so much for joining us today.
Thank you so much for having me. Happy to be here.
So in a previous episode here on our podcast, which we will link to in our episode notes, we have covered the importance of standardized pregnancy testing procedures in cancer care and incorporating those into routine practice. But just as a refresher, can you briefly explain why pregnancy testing is essential in cancer care?
I remember in that episode, Kelsey Miller, clinical nurse specialist in oncology and infusion therapy, made some key points in understanding the importance of pregnancy testing. She stressed that it's crucial to identify those that may be pregnant as exposure to certain cancer treatments like chemotherapy or radiation while pregnant may be harmful. These treatments can cause changes in reproductive cells and the developing fetus. It was pointed out that women of childbearing potential should have documented testing due to adverse effects such as the risk of fetal loss, low birth weight, or birth defects. And these are serious impacts to the fetus and to the family. So this testing is crucial, and explaining the importance is just as crucial. Just to piggyback off of those points, I would also include in any discussion about testing for pregnancy to give information on some options. So for example, what about fertility or fertility counseling? Healthcare professionals can talk about the risk of pregnancy and the potential risk to future fertility. Some treatments may impede on the ability to conceive in the future. So it's important to provide education and preservation information. These can feel like impossible decisions to make, and finding ways to discuss them, provide education and support for our patients is so important.
Thank you so much for summarizing that. Certainly a great place to start for today's discussion. So before we move into specifically talking about the psychosocial considerations when we're doing pregnancy screening and testing in cancer care, let's just talk about pregnancy testing and screening in general context, which we know can have its own set of psychosocial impacts. So what types of psychosocial effects can pregnancy testing have on any person in their everyday life?
I would say in general, in everyday life, pregnancy testing is actually still really complex. It's more than just the positive pregnancy test and the happy parent we may see on commercials. For those that are hopeful for a positive test, there's still a lot of anxiety, worry, fear, maybe before, during, or after the results. And I think about how long this person has been trying to conceive and the financial impacts involved, change in family dynamics. What if that test comes back negative? Then I think about the potential disappointment or the heartbreak. I also consider the flip side. Those that are scared of a positive result for fears of becoming pregnant for a range of different reasons. There are many ups and downs. It's very multifaceted.
Absolutely. And then when you think about what we're going to talk about, which is putting that then in the context of something that is also on its own very stressful, I think it paints the clear picture for why this is such an important topic for us to talk about.
Absolutely.
We know that routine pregnancy screening is important and required as part of cancer care and during cancer treatment. So what kind of emotions do patients experience when they're having to do both pregnancy screening and also undergo cancer treatment at the same time? And how can this experience maybe be similar or different even from those patients that you just described, those maybe just in everyday context?
When you add a cancer diagnosis to the mix, there are always going to be heightened emotions. And as I just described, pregnancy screening comes with its own ups and downs. But for people diagnosed with cancer that are of childbearing potential, we have to consider how this testing could impact them. So we never know what someone has been through, and it's important to lead with empathy while providing education of the importance of this testing. So someone may find now that finding that pregnancy testing is a dreaded experience instead of what they thought would be a joyous one. They may now have those feelings of anxiety, fear, uncertainty, confusion. I think the experience has some similarities in terms of emotions, but the biggest difference, you're now being tested because you have cancer and because treatment could impact a growing fetus. It's another test result that decides your future after a diagnosis. And that's really not how anyone expects to learn this news or have to have this testing.
Very complex. And as you said, as we're doing this, usually multiple times over a person's treatment for their cancer, the feelings about it might change and morph over time as well. I know that some institutions do a blood-based test, and so that sort of gets roped into the routine blood tests that they're already doing and may not be as obvious to patients, may not be something that they're kind of confronted with every time. If there are sites that are still using urine dip testing or urine testing to do this, again, that's a little bit more in the patient's face every single time that they have to do it. And so I think that's something to consider for programs about what is the best approach. There are lots of variables in there, but what is the best approach to conduct this testing that perhaps is the best experience for the patients that are involved?
Great point.
So when we find that pregnancy tests are positive in an oncology setting, and I think this is challenging because it depends on, I think the answer to this question will depend on, well, when are they found? When do they come about? When pregnancy tests are positive, we find this as part of any screening in oncology. What are the emotions that patients can experience?
If the test is positive, it is hard to say. Everyone has their own individual reaction, but you can expect a range of emotions, just like anything else, as we said. There may be moments of happiness knowing that you're pregnant, especially if this was a result you had wanted before the diagnosis, but that may turn to worry, fear, questioning what happens next. What will happen to the pregnancy? Is it safe to be pregnant? Is it safe to have treatment? This test result can be then very scary with all these questions and concerns. And it's important to recognize that all these feelings are absolutely normal. And as nurses and as other healthcare professionals, these are really pivotal moments where we can provide education and support to patients.
Yeah, I think you alluded to this. There are certain treatments, and we won't get into the specifics on this episode, but there are certain treatments that can be given while a patient is pregnant. And in fact, I have a few memories during my own clinical practice where the patient was already pregnant and then their cancer diagnosis was discovered. And so that also is very treatment dependent. But of course, as you mentioned, that's a primary concern that patients consider of how does finding out that they are pregnant, how does that impact or can that be balanced with the treatment that they either are already getting or are planning on starting? So it is important to, I would say, don't make any sweeping generalizations to patients unless, you are quite confident for sure that yes, this treatment can continue or no, it cannot, because we know that's a very primary concern for both patients and families in this situation. What do you see as the best emotional support that nurses and other healthcare professionals can provide to patients when they are in this circumstance?
I think it's important to always lead with empathy and kindness and an open mind. So you don't want to assume you know or understand how a person feels or may respond. Allow your patients to share with you how they're feeling in a non-judgmental manner. This can be an incredibly vulnerable moment, and nurses can be a valuable source of support. Take a moment to just listen, normalize their feelings, or let them ask questions. And I recognize it can be difficult to know what to say or do, but sometimes just being there for someone in those ways is incredibly meaningful and opens up more effective communication and trust. And really, communication and trust are key factors in providing any type of emotional support. It's also good to know of additional supportive services. So whether it is a hospital social worker or a local support group, these are helpful to provide ongoing support because that can be needed as well.
Absolutely. And in additional, of course, to emotional support, as you described, education is an important follow-up to that as well. So what type of education do patients need related to the effects of their cancer treatment, their treatment options, their options regarding pregnancy? What are some of the highlights that nurses should keep under consideration when talking and counseling patients?
Education is so valuable and it's crucial to be able to make informed decisions about your care. So patients absolutely need to fully understand the effects of their treatment, really anything that impacts care and their options concerning pregnancy. It can be challenging for some patients, though, as they are already very overwhelmed and scared, and in many cases don't know what to do or what to ask. And really, that's not uncommon at all. Patients should know of any potential side effects, how to manage those side effects, and how they may impact their day to day and their future. So patients need all this education so they can be part of the decision making process and be part of their own care. This practice is really what we call shared decision making, involves doctors, nurses, anyone caring for someone, and the patient making decisions together. So in order to be part of this process, it's important to know all the facts. So everyone can evaluate treatment options, impacts on health, impacts on the potential for future pregnancy. And it can be helpful for us as the healthcare professionals to encourage our patients to explain their own values, what's important to them and their family, and provide this education in easy to understand language with various material and the style that works best for them. And we can empower our patients to make these decisions, have more say or control of their care.
Absolutely. I think that we can acknowledge in the state of healthcare, especially in this state of women's rights around pregnancy and their legal ability and right to potentially terminate a pregnancy. I think that's something that obviously comes into this discussion. And while it's not the focus of our podcast today, I think we'd be remiss without at least acknowledging that that is part of that shared decision making. That is usually presented as a potential treatment option. And those discussions have become even more complex and challenging in an already challenging situation based on the limitations and the restrictions that patients now have available to them to consider and pursue that option if that is what aligns best with, as you said, with their values, with what is important to them. I just think we need to also recognize that that is the reality. And while I'm thankful, and because we are doing more routine screening, that finding positive pregnancy tests in the midst of treatment or before treatment, hopefully that is happening less and less, but it is still happening. And it is a significant moral distress and dilemma, especially to our partners, our physician colleagues and nurses who are in these situations with patients trying to do their best to provide that shared decision-making and all the treatment options that are available. But this new limitation that perhaps was not something that was so challenging before is now very much a part of that decision-making. And so I just felt that we should address that elephant in the room, even though, again, not necessarily the focus of our talk today.
Excellent points. I appreciate you bringing that up.
So now let's maybe flip to the other side. We talked a lot about what happens if the pregnancy test comes back positive. Let's look at from the other direction. So when a pregnancy test is negative, perhaps you would assume that it's a relief for people who are undergoing cancer treatment. But as you had mentioned earlier, for patients who have had struggles or were actively trying to conceive prior to their cancer diagnosis, this negative result probably comes with lots of mixed emotions. What support can healthcare professionals provide to patients in this situation?
That's exactly right. This is a great point, too. So, it very well may be a relief for many, or for some rather. But for the patient that has been trying to conceive, taking another pregnancy test could be so daunting or triggering and bring back so many moments of grief. Seeing the results being negative could be heartbreaking all over again. Some people may find some relief knowing their fetus won't be harmed and they won't have to make tough decisions. And then there may be guilt for feeling that way. There's no one way to feel or right or wrong way to feel. And for healthcare professionals, again, I bring back those skills I talked about before, always leading with empathy, active listening, open communication. Let them know their feelings are valid and anything they feel is okay and normal. This is also why it's so important to not assume how someone will feel when being presented with the need to take the test and then seeing the results. And when providing education on the importance of this testing, it can be helpful to understand the patient's perspective and let them know you're there for them really every step of the way.
Absolutely. Thank you so much for providing those recommendations in that context. As you mentioned, making that assumption is not recommended. And as we talk about on every podcast, just considering the impact of implicit bias and making assumptions going into conversations, discussions with patients. So I think that's an important one to consider, of not assuming how they're going to feel, not assuming that there will be, relief, celebration, but just considering what the other side might look like. And so going in and letting the patient lead in terms of having whatever their emotions are. As you said, there's no right or wrong reaction, but supporting them, being there to support them in whatever that feels like for them.
Yes.
When we're considering education that we provide to our patients, we as the healthcare team, I think it's really important, and this can be maybe the most pivotal piece of the education that we provide to patients as they're about to enter into their treatment. Talking about this openly, not only pregnancy screening, contraception, what might happen if an unintended pregnancy would occur during treatment. So what are some of the education kind of pearls that we should emphasize with patients? And really, when should this education most ideally be provided?
Patients really should fully understand that pregnancy testing could be done at multiple times throughout their treatment and the importance of that testing. So healthcare professionals can discuss the importance of even contraception in a respectful way and ask about the patient's values in terms of use of contraception. In the event of an unintended pregnancy during treatment, patients should know how this could impact their care, the growing fetus in ways we talked about previously. That includes the potential of fetal loss or birth defects. And I completely respect these are difficult conversations to have even once, but they're absolutely a must. And in my opinion, this education should be provided up front. It should not be a surprise to the patient that additional testing is being done really at any point or any appointment. This is especially true since pregnancy testing and the emotions surrounding them, we've been talking about, are so complex. This information should be provided up front and on an ongoing basis. So I think patients need continued open dialogues, open conversations surrounding these difficult topics. And, if this is done continuously, it allows patients to understand the importance of what is being explained. And when talking of the importance of contraception or how the possibility of unintended pregnancy during treatment could impact their care, this also really can be done more than once. So not only does repetition reinforce education, you also have to think of the experience of the patient at these first appointments. So, how scary and overwhelming it is to be told all of this information. And with that stress, it's not unheard of to have trouble even concentrating during that first appointment or remembering what's being told. So ongoing assessments and ongoing education is really important.
Absolutely. I agree. And I really appreciate the emphasis on it's not a one and done situation, which is, I would say, true for all of the education that we provide to our patients undergoing treatment for their cancer diagnosis. As you mentioned, the first time we give them we maybe overwhelm them. They come in overwhelmed with that experience. And so while there are some important things that we have to reinforce and educate at that first treatment visit or in the early stages of their diagnostic workup and treatment, there are multiple opportunities beyond that to reinforce. And as you said, that's a critical part, especially in this type of situation where the risk persists throughout all of their treatment. So now we'll shift gears just a little bit and address some potentially more complex situations for the healthcare team. When we are working with patients who are gender diverse, non-binary, transgender, like for an example, a trans man who has female reproductive organs, how can the healthcare team approach pregnancy testing and support and these discussions with these patients?
What an important topic and question. As many gender diverse, non-binary, or transgender patients face barriers to care and health disparities, as healthcare professionals, we can create a safe space that values inclusion and advancing access to care. So these populations often report mistrust of the healthcare system, mistreatment, and inconsistencies in their care. And in order to address and break those barriers, we can start with making sure we're using gender affirming actions and language. And this starts really with the very first interaction. So it can be helpful by starting really with how you understand your patients and collect information. Things like electronic health records can be advanced so patients can select their gender and pronouns. But not only that, we can review what is called an anatomical inventory. This allows professionals to lead with patient-centered care and provide the best treatment education. I would add to make sure we're leading with trauma-informed care as well. This will develop feelings of safety and trust. And combined, you have a more educated and empowered patient and can collaboratively make decisions about their care. And when discussing pregnancy testing, it's important to explain why these questions are being asked, how the testing will be done, what to expect, and be understanding of the challenges someone might face in these situations.
Absolutely. I think you gave some great points for us to consider in this situation of working with these patients. Let's move on now to the adolescent and young adult population. We have to acknowledge that they may be sexually active. And so discussing sexual activity with patients that are young, even young adults that perhaps even have their parents still heavily involved in their care, that discussion can be uncomfortable for patients, their guardians, their family, their caregivers. And so how can the healthcare team approach the importance, the necessity of pregnancy testing, screening, and educating patients about reproductive health and safe sexual practices in the midst or in the context of also receiving cancer-directed therapy?
This absolutely can be hard for parents or caregivers to discuss the possibility of any sexual activities as it relates to their children, especially in adolescence and young adult ages. And for pediatric patients, parents and guardians could be heavily involved in the patient's care. So although potentially uncomfortable for them, the importance of these conversations really outweigh that discomfort. So you could start by acknowledging that the conversation is hard and be open to feedback, explaining that pregnancy testing is important for anyone whose body is capable of pregnancy and how this could impact care. Understanding reproductive health and safe sexual practices is really important for anyone, but for younger patients, there may be some misunderstandings or myths that can be addressed so we can really best protect them and keep them safe with this education. And engaging parents in the discussion while assessing their comfort level will help guide that conversation.
Very well said. And I think as we are seeing patients, unfortunately, being diagnosed younger and younger with cancer, that these types of conversations may become more common. And even for those patients that are sort of on the cusp of pediatric versus adult care, we might start to see these types of conversations becoming more prominent in what has historically been adult-based care. But now if we're seeing patients sort of in that age range, again, just another thing to consider as we provide that education to patients and the family or caregivers that they have involved in their care. So another, I think, complex population that we want to consider is just acknowledging that our patients come to us from various cultural backgrounds, and they might approach pregnancy and sexual health differently. So how can healthcare members, as they're having these conversations, navigate this discussion about pregnancy testing for patients whose cultural or religious beliefs differ from their own?
In order to fully allow for shared decision-making in cancer treatment, I think healthcare professionals must come from a place of cultural competence, but also cultural humility. Of course, it's important to educate oneself of the values and beliefs of diverse populations, cultures, or religions that are different from our own, being respectful and really understanding your own biases. When we think about cultural humility, though, we're adding a lifelong commitment to evaluating ourselves and also allowing our patients to tell us about what's important to them because they are the experts in their own lives. A patient's culture and religion absolutely can dictate views on pregnancy testing, pregnancy overall, and sexual health. So make sure you're asking questions and being curious and provide education in a way that respects their values. That's really important. And if your beliefs differ, be mindful of your responses and your own reactions.
Yes. Again, all of that applies to essentially any conversation, any education point we need to address with our patients, that inherently there are so many diverse cultures that it's probably, if you're going to assume anything, assume that their culture is different from what yours is, because that likely is the scenario. And so, as you said, approaching that with humility, asking to understand, asking to learn, and being able to accommodate their needs, their preferences, and make sure that the care we provide aligns with what is important to them. So we've talked through some specific scenarios, even some special, unique populations. But now more generally, how can just the healthcare team approach these types of sensitive conversations about pregnancy testing and cancer care? And are there any other support considerations that we should account for? Essentially, do you have any quick tips to give us so that we can keep those in mind as we are approaching these conversations with our patients?
Yeah, well, I definitely agree. It's a very sensitive conversation. And you may worry, what if I say the wrong thing or do the wrong thing? I hear that concern a lot. It's not uncommon at all. And I believe this means you're already, you have your patient's best interest in mind. And that's a good place to start. I would say, start with making someone feel comfortable as, they possibly can, considering the circumstances. You could lead with introducing yourself, your role in their care, your relationship with the other people on the healthcare team. This helps to build a positive relationship right from the start. Again, always lead with empathy and active listening, normalize any concerns. And when giving information, make sure it's clear and concise. Check in regularly to assess understanding and always invite questions. We want to make sure this is a safe space, a safe environment. So it's also important to ask about someone's support system and who's caring for them. Is there someone that they can discuss this information with, talk to for support, bring to appointments with them? Who helps them with the decision making, and include that person in these conversations too. You can also be prepared with supportive information and resources again. And all of these considerations can help really anyone support a patient, make them feel heard or even more empowered. And then just some additional tips, I would say always ongoing self-assessments are important. Check in with yourself and often ask yourself, how am I feeling? Is it impacting how I'm able to provide support? Consider self-reflection and self-awareness, and just knowing yourself can better prepare you in supporting and educating others.
Yes, for sure. Some great tips there. Thank you for sharing those. And I think acknowledging again that we as healthcare providers, we have our own reactions and our own emotions. And so giving time and attention to those and processing those in a way that is helpful and healthy to help us cope with the various ups and downs that we experience in providing cancer care to our patients. That's certainly very important. Well, Marissa, you've given us a lot of great information, but can you apply, maybe give us a real world scenario, a case study example of how you've seen this play out, a pregnancy testing happening on an oncology setting and kind of what the outcome was?
Well, yeah, this conversation does remind me of one patient that I've had recently. I'll call her Nora. Nora was 43 at the time of her diagnosis of breast cancer. She had a situation where she was told she may not be able to conceive. She had abnormal menstrual cycles, and it was typical to have missed periods for many months on end. So she thought she was going through menopause, and she really found it strange that she would need to be tested for pregnancy before she started treatment. But she did get tested and the results were negative. And she'd never taken a pregnancy test before and didn't expect to feel so stressed and sad about this result of that negative result. She began to realize she never really grieved the fact that she didn't have children and may not have children. She didn't bring this up to her healthcare team, but did discuss this in some counseling sessions. And then she decided to share this with her nurses, and it opened up a dialogue that began a more supportive process. When getting tested, she was able to speak openly and not feel so ashamed. And her healthcare team, fortunately was so supportive and understood her needs and values better because of this conversation. So this example reminds me that it's important, again, not to assume anything and always check in on how your patients are feeling about pregnancy testing.
That's a really great example. And I do think all the things you said, it just emphasized the importance of not assuming the reaction, and also that patients, how they feel and what their reaction is might not be immediate. It might be something that, again, they reflect on and they think through, and they might still have feelings to process and reactions to work through. And so you exactly said it, checking in with patients, not just right away. And I think the also thing, I mentioned some institutions do a blood-based test. And so that wraps up into all the other labs that we do, and it becomes somewhat automatic. I think we need to be cautious in that situation because we are doing this repeatedly. And because our patients will all have unique reactions and emotions to it, we don't want to become robotic in terms of how we tend to those emotions and those reactions that patients are processing themselves, even though we see it very operational of just the box to check because it's a test we have to do before we can move forward with treatment. Always important to take that step back and check in with that patient to make sure that you're not overlooking something and giving them that space to share with you how they're feeling and how the care that we can provide can be changed or improved to meet their needs, as everyone's needs are uniquely different. Well, Marissa, thank you so much for joining us today on our episode of the podcast. It's just really been a great conversation, a challenging topic, a sensitive topic that happens in various frequencies, depending on kind of what environment a nurse might work in, what kind of subspecialty, what kind of cancer they are seeing and treating most often. And so not something that everyone is seeing universally, but certainly when you do encounter working with patients, having to talk with them about pregnancy screening, testing, reveal results with them, it's a complex topic. So I really appreciate you spending time with us today and sharing your insights.
Of course, you're very welcome.
As we reach the end of our episode, we do like to run through a series of quick fire questions just to help us summarize some of the important points that we talked about today. So to start that, how do you think healthcare professionals should evaluate their hidden or their implicit bias about these psychosocial concerns and issues related to pregnancy testing?
The important thing to remember is that these biases can actually create barriers and contribute to disparities in healthcare. And it's important to really be able to evaluate them. But it's not always easy to do that because you have to first really admit that you may have them, which is not always easy to do. These are sometimes or always unconscious attitudes or beliefs, and they impact the way we see our patients and the way we make decisions about our patients. So ongoing education on implicit bias is very much needed, but it's not simply just education. I think it's also the action. Before you can evaluate, you must be able to acknowledge and be self-aware of your own assumptions. And then the action comes in challenging them and welcoming that feedback from others.
What are some common misconceptions about pregnancy testing and cancer care?
I think a common misconception is that if a pregnancy test comes back positive, there are no options for treatment. From what we discussed today, education and communication with your healthcare team can help clear up those options you may have and bring back the element of shared decision-making to make these decisions together with your healthcare team.
What's something about this topic that's not often discussed, but you wish people knew more about?
I would really just say this conversation today and understanding the psychosocial and the emotional impacts of pregnancy testing. For healthcare professionals, it can be part of their routine in their day, as you said before. But for patients, this can be a life-changing moment full of scary and difficult decisions to make. So I wish this was really discussed more. I'm always a proponent of mental health, and I strongly believe this should always be considered. And I don't think it's discussed enough. So I'm always on a mission to change that.
Wonderful. Well, I think this podcast will certainly hope contribute to that. What additional training or education do oncology nurses need to help stay current in this topic?
I would say stay up to date with advancements in treatment, safety protocols. If a patient does become pregnant, up to date on the emotional impact and addressing mental health, but also information on self-care, taking care of yourself while you're caring for others. And any ongoing education, just continue to explore what your options for learning are. Look for trainings with different communication skills and attend conferences if you can. This is a great way to stay current and meet like-minded people to learn more.
And finally, what are some additional resources for patients or maybe other providers who want to learn more?
I think it's also worth saying to continue to use things like ASCO and NCCN for updates and guidelines, those journal articles. I know Oncology Nursing Society has these informative podcasts and options for professional development. And CancerCare has some great resources for both patients and providers. For patients, we have material on doctor-patient communication, advocacy, treatment, fertility, accessing support. These materials are really perfect for providers as well. And our website, cancercare.org, has a wealth of this information.
Wonderful. Well, I think you've given us some great options to pursue in finding that education that not only keeps us current as nurses in this area of our practice, but as you mentioned, I think earlier, of be prepared. Don't wait until the first time a patient's result comes back positive to think about what I would do or what I would say or what the next steps are. And so thank you for sharing those resources that can help us feel prepared to have these conversations and to help move our patients through this experience if or when it happens. As I said, Marissa, thank you so much for bringing your expertise to this conversation today. Do you have any final comments to share with our listeners?
I would just like to acknowledge again that, this is not an easy topic for conversation. Pregnancy, testing, cancer, reproductive health, fertility. These are all hard topics. And I'm just so proud to be part of this discussion to help normalize these conversations and hopefully just make them a little easier to have with patients.
Thank you so much for your time today.
Thank you for having me.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.